Welcome everyone to the webinar today sponsored by BioLight Technologies on how lasers work and how to choose the right laser for the results that you are looking for. This is Debbie Orr, and we're so fortunate to have one of the leading authorities on energy medicine and laser therapy with us today, Dr. Graham. Dr. Graham has been a licensed chiropractor for 35 years, and he heads up our research and development and has a vast knowledge and experience in this area, and has been just really deeply entrenched in this field for many, many years. I have learned so much from him over the years, and I know you will also. So, Dr. Graham, I'm going to turn the program over to you.
Thank you. So, what is the difference between your laser and others? Why is your laser best? What is the best laser? These are just all ways of asking, why should I purchase your laser over the next guy's? Well, these are not valid or even complete questions. To me, this is like asking, what's the best ball? To complete the question, you have to add, what do you want to do with your ball, or what do you want to do with your laser? Which brings us to our first problem. Few know what they want their laser to do because few really know what different lasers actually do. So this short training video will attempt to answer this question and at the same time clear up some of the confusion around low-level laser therapy systems in general. Most providers will ask this invalid question because they've actually been told that all low-level lasers do basically the same thing, with the exception of theirs, of course, and that theirs is the only one that really works, and then they give some specific reason for this. The confusing part is that every different laser company has told them the same thing, but they all have different reasons why theirs is best. And I've heard a lot of them. Our lasers have the greatest penetration, our laser is the most powerful, our laser uses super pulse laser diodes, or our laser uses the exact and only wavelength to stimulate the sodium pump, or our laser uses an infrared wavelength that does not create heat. And, you know, the list of foolishness just goes on and on. So no wonder people are totally confused. Every time they ask someone that's supposed to know the truth, they get conflicting information, and even worse, that they're told that the last person they talk to is either a liar or just totally ignorant. So with all the professionals saying that all the other professionals are idiots, who are you supposed to believe? Well, science is probably the good place to start. The science around low-level laser therapy has been around for more than 50 years, and it's not really that complicated, and it's not that confusing. So let's start with some basic scientific facts that no one can successfully argue with because, as like I said, they are facts. First is the fact that every different type of low-level laser affects the body in a different way. Every different wavelength of energy, every different power density, every different light source, whether it be laser, super pulse laser, LED, SLDs, continuous wave, pulse continuous wave, or pulse duty cycle, and so on, they all have their own mode of action, and they all affect the body differently. Now, describing all the different forms of therapy would take more time than we have during this session, so in order to narrow the subject down, we're going to determine exactly what you want your therapy laser to do. To determine this, you're going to have to make a decision. What is your philosophy of healthcare? How do you want to manage symptoms? Are you interested in just killing pain for the sake of killing pain, which can be done with low-level laser therapy, and it's a lot safer than taking analgesics, but it's really not much more therapeutic? Or are you interested in managing symptoms by truly providing to the body what it needs to recover from what's causing the pain? Now, if your philosophy of healthcare is to manage symptoms through correction of the body, then I believe what you're looking for is a true therapy laser, one that will stimulate or enhance many healing activities. So first we're going to describe what this laser is, and then we're going to describe all the basic therapeutic benefits that it delivers, or at least most of them. Then we're going to compare the PTL2 BioLight laser to other lasers of the same classification. This laser must power from one to several 635 nanometer true laser semiconductor laser diodes, each fully collimated, powered at less than 5 milliwatts, and each one of these laser diodes has to be pulsed at specific pulse frequencies. This laser is going to be classified as a Class 3A laser. This classification of laser delivers a physiological or a natural dose of care, meaning that it is non-toxic. or has no effect on normal tissue. This versus the pharmacological laser, or first aid dose of care, which is always toxic. This is the classification of laser that is utilized in tens of thousands of research studies in Russia and Europe for 40 years before the idea of laser therapy ever even came to the U.S. This type of laser forms the foundation of natural energy medicine. So what are the therapeutic benefits of this type of laser? They're quite extensive, so we're going to try and outline them as simple as possible and as briefly as possible. So let's start with the word laser itself, which is not a word but an acronym for light amplification by stimulated emission of radiation. Why is this important? Because laser light is the only source of coherent energy that we have, and it's vital for all low-level laser therapy. The next phrase is light therapy, which began as exposing your patient to the sun or some full-spectrum light source after science discovered that patients that were deprived of sunlight suffered significant loss of health. Today's light or laser therapy is totally different and should never be called or even considered light therapy. Today's laser therapy does not replace natural sunlight. In fact, it's almost the opposite. Instead of utilizing full-spectrum natural light, we use a very small fraction of man-made light that has specific qualities. We use laser light because it's a coherent energy. Einstein theorized 50 years before lasers were even invented that the cell-to-cell communication in the body utilized coherent energy. And until we discovered how to create coherent laser energy light, light therapy was just limited to sunbathing. Next, science discovered that a wavelength of around 632.8 nanometers was one of the primary wavelengths the body utilized. This was identified in many ways, from identifying the energy given off during the division of a human cell to mathematically matching this wavelength to the unit of measurement that God stated He used to create us with. This is why we utilize only true 635 nanometer laser diodes in our therapy systems. Next is the word biomodulation. This word is important because it helps describe several other functions as we continue through this outline. Biomodulation is defined as changing the natural biochemical response of a cell or tissue within the normal range of its function, stimulating the cell's innate metabolism, thereby allowing the cell to heal itself. If you study this definition, you'll find that it's one of the most extensive descriptions of natural health care that you can find. And the strange part is that it was not written by natural health care providers, but by 3 different medical research doctors that were describing the effects of 635 nanometer laser therapy on the body. To biomodulate tissue with light or a photon is called photobiomodulation, and it requires very specific processes. We'll start with pigmented substances that accept photons in living tissues are called chromophores. Now, chromophores are the light receptors in the body that we attempt to activate with photons during laser therapy. All chromophores will have their own spectrum of wavelengths that will activate them. However, all physiological chromophores share one specific wavelength of activation, and this wavelength is 635 nanometer. This is why this is the second reason why we utilize 635 nanometer laser diodes, because they are the only ones needed to activate all chromophores in the human body. Then, when a photon within a specific wavelength spectrum, having the correct power density, strikes a matching chromophore, the energy of that photon is transferred to the chromophore, and the photon ceases to exist. Now, this basically describes how the energy of light is transferred to the body. The correct power density or brightness of the laser is as important as the correct wavelength. Just like the chromophores in your eyes, too much light or not enough light does not properly activate the chromophore, which means too much light or not enough light when you're trying to see something, you will still be blind. Okay? There's a spectrum of brightness and a spectrum of wavelengths that is required to properly activate physiological chromophores. And the power density of a laser should be between somewhere about 1/3 of a milliwatt to 5 milliwatts for proper activation of all physiological chromophores. This is why we power our lasers at less than 5 milliwatts of power for each laser diode. Next, when the chromophore accepts a photon, it causes a biochemical change within the cell or tissue. The most important part of this statement is that the chromophore accepts the photon. It is not the photon that accepts the chromophore. The chromophore is part of the body, and the body has to be in control. It can accept the photon if it needs it, and it can ignore it if it doesn't, which means that there is no toxic dose to this therapy. You can shine this laser on a patient as long as you want, and it will never have an adverse effect on normal tissue. This is called a physiological dose of therapy. However, you must remember this is not true for other wavelengths of energy. This biochemical change will either activate or inhibit the cell's function. Either way, this is called photobiomodulation, and it is the first goal in low-level lasers. Now, you can biomodulate almost any cell found in the body, human or pathogen. Now, 635 nanometer laser light will significantly inhibit the growth of all known pathogens while at the same time activate the health and growth of all human cells. This is the way natural health care works. What is good for the body is always bad for pathogens and vice versa. Again, this effect is not there for other wavelengths of energy. In fact, some infrared wavelengths have exactly the opposite effect. Photobiomodulation can occur in three different forms. The transferred photon can change the energy state of an electron, or it can donate an electron to a redox molecule, or the transferred photon can ionize a chemical bond. And when one of these three functions occur, there can be one of four distinct effects of photobiomodulation on the body. The first one, we can have growth factor production. Secondly, there can be pain relief. Thirdly, there's a reduction of inflammation and promoting a first intention healing. And the first intention healing is where you really see the miraculous healing effects with low-level laser. And the fourth is direct trigger point stimulation. Now this leads to the ultimate goal of photobiomodulation, which is biological amplification. When photobiomodulation occurs, the photon activates a chromophore, and that single enzyme molecule rapidly catalyzes thousands of other chemicals. This process is similar to the well-known calcium-regulated second messenger CAMP cascade. And this biological amplification process explains how photobiomodulation can produce profound systemic cellular and clinical effects. Or in simple terms, when you treat one wound on the body, every wound on the body receives the exact same treatment, even wounds on the inside of the body you didn't even know existed. Now, the manufacturers of infrared lasers brag about how their power and wavelength allows for 5 to 10 centimeters or even sometimes more of penetration so that you can reach the area of pain with their laser energy. Well, when you use the 635 nanometer lasers, you only have to reach the first living cell to produce biological amplification that utilizes the optical windows of every living cell to reach every other living cell in the body almost instantaneously. Biological amplification is the way the body communicates and delivers needed energy to all parts of the body, and it is so much more advanced and sophisticated than simple penetration of energy that it's really an insult to the body to even try and compare them to each other. So next we have the fact that this laser is capable of introducing an internal neurological environment called neuroplasticity. This represents the brain's ability to reorganize itself by forming new neural connections throughout life. And introducing neuroplasticity in an organized, controlled manner, such as using 635 nanometer low-level laser, represents a new, rapidly evolving approach to the healing of any traumatic neurologic condition. Finally, this laser will be able to produce pulse frequencies at a specified number of times each second. Biomodulation of tissue through the use of pulse frequency is called frequency biomodulation. The latest science and research states that there are 3 different bandwidths of frequencies the body utilizes. One is comprised of very low frequencies, usually less than 10 hertz, that is similar to the basic Earth frequencies. The second band is very high. It's from about 80 billion cycles and higher. And these higher frequencies match the resonant frequencies of each cell type, organ, and system. These frequencies tell the body, this is what I am and where I am. It's their identifying and location frequencies. The third frequency band is one of the most important bandwidths and the ones we use the most, which are the frequencies that the body uses to communicate, control, and manage every function of the body. This bandwidth is from 40 to 70 billion cycles per second, which is still much higher than what we can actually produce manually with our technology today. But frequency is basically information, and we know that all information on this planet can be corrupted, including the information in your body. So the basis of frequency therapy is to help the body restore the corrupted frequencies and frequency-based information so that it can restore itself. This requires your therapy laser to be able to deliver precise frequencies that resonate within octaves of the normal, healthy frequencies of the body. Frequency therapy is a vital component to any true low-level laser therapy system. It takes the low-level laser energy described above from a general health stimulation, like good food and sun bathing, and converts it to a targeted therapy for any cell, tissue, or organ of the body that may be suffering from any pathogen or malfunction, from anything from allergies to autoimmune processes. So if you're looking for all of these benefits, plus many others that we don't really have time to cover today, the above described therapy laser is the one that you should be looking for. Also, by selecting all the benefits listed above, you have eliminated about 80% of all the other low-level lasers on the market. This includes all the Class 4 and all the Class 3B lasers, and all infrared and ultraviolet lasers, plus there's a few others. I know that many people will still argue the fact that these other lasers are highly therapeutic. I understand that they can dramatically change symptoms, and some of them even produce one or two similar benefits that are listed above. But it's only the 635 nanometer pulsed low-level lasers that have the ability to produce all of these benefits that are listed above exactly as described, with virtually no risks or side effects. Now, there's several companies that manufacture the above described true low-level lasers, including the manufacturers of the BioLight therapy laser. Now we can begin to answer the original question: why is the BioLight therapy laser better than all the rest in this class? This leads us to the first basic problem in trying to compare lasers. If you go to the store to buy a baseball, you know exactly what you're buying. You can purchase an official baseball that meets very specific standards for any league you like. You can also buy a baseball that is so cheap that it doesn't qualify for any league, but you still know what you're buying. You can make an informed decision when you purchase a baseball. However, when you go to buy a low-level laser therapy system, there's no standards. There's no standards of functions or performances or any standards that will let you know what you are buying. You cannot see the difference between the qualities of laser diodes in your unit. They may cost 25 cents or they could cost $200 each. The only thing that can tell the difference really in your therapy laser is your patient's body, and by that time it's a little late. So without set standards, you just have to trust the manufacturer when he says, "Trust me, it's a good unit." Well, I disagree. I think there should be set standards for our industry. I think you should know the quality of the laser diodes and the optics in your laser. You should know what the pulse frequency range and precision is for that laser. You should be given a list of pulse frequencies that are directly related and designed for that pulse therapy laser. You should be able to obtain any information about that therapy laser that you want and then be trained well enough to know what each detail means. Only then can you make an informed decision on your purchase. I still say there's something seriously wrong when you know more about the quality of a $5 baseball that you use to play a game than you're told about a $5,000 to $15,000 and even higher low-level laser that may determine your long-term health or even your life. So why is this? Well, the answer is pretty simple. It's because if you were a professional baseball player, you know the difference in one baseball and the next. And you demand that only official professional league baseballs are used when you're playing the game. It's the professionals in any field that create and demand the standards of their equipment. Unfortunately, in pulse low-level laser therapy, it seems that no one really knows what the standards should be. Not the manufacturers, not the professional instructors, not the users, and certainly not the patients. And unfortunately, very few are interested in learning, setting, or following any standards. Low-level laser therapy should be the standard required care for many serious health issues such as traumatic brain injuries, any and all infectious diseases and wounds and burns. But instead, low-level laser therapy is still considered experimental and is seldom even recognized in the eyes of the insurance companies. We as a professionals in our industry need to demand changes in our industry that will set the standards for our equipment and therapy. Instead of this, most manufacturers keep the details of their products a secret, which means I cannot really comment about them to any degree of certainty. So instead of guessing, I'm just going to tell you what the details are about the BioLight laser and let you decide what laser is best for you. Next, I need to describe natural energy medicine. It is a combination of informational forms of healthcare. It's not just laser therapy or frequency therapy or homeopathy or any number of other informational forms of medication or of therapy. It's a combination of all of these, plus all other forms of informational medicine, and that even includes whole food nutrition that, when placed and utilized together properly, forms a complete healthcare system that is truly the healthcare system of tomorrow. Our class of lasers is utilized in natural energy medicine. In fact, it's the foundation of natural energy medicine because it's the carrier and or the activator for all the other components of natural energy medicine. Now you have yet another decision to make. Are you interested in purchasing a tool that you have to build your own therapy system around, or are you interested in purchasing a complete natural energy medicine therapy system? So now the comparison is two-part, the laser itself and the therapy system that it comes with, if any at all. We'll start with the quality of the laser unit itself. Let's start with laser diodes. We use only the finest quality laser diodes on the market with the highest quality optics. But this is just basic standard expectations for low-level lasers, not something that we should have to brag about. But it's definitely something that we should be terribly ashamed of if we didn't. If we were building a car, it would be like bragging that we use glass instead of saran wrap for our windshield. There's lots of manufacturers of quality laser diodes, and if you need to know where we buy ours and the quality, just ask it, and we can forward that information to you. Next is the technology. Some of our clients wonder how our therapy laser can be better than others when they look at the size and the weight of our laser. The answer is technology. We use the latest electronics and build our printed circuit boards with surface mount technology, which allows us to build a very complex computer and place it in a very small case. This allows us to have a low-level laser therapy system with the latest technology that is the size and weight of most remote controls. Remember that size and weight is important, especially for the user. You don't have to lug around a 5-pound brick to use low-level laser therapy. The BioLight or a PTL2 weighs 7 ounces, fits comfortably in your shirt pocket. It can be operated with one hand and still has more technology than any other low-level laser unit on the market. Then it comes to power. Most people may not think of this, but the power and the battery systems are usually one of the most difficult and expensive components of any portable electronic device. You want long life, yet a very fast recharge system that develops as little heat as possible. Along with this, the battery has to be very small and lightweight. To accomplish this takes the latest battery technology, which is why we utilize lithium polymer batteries with well-engineered charging systems. We all know that every few years technology doubles in this country. What was new and fantastic 7 years ago is now outdated and discarded. How old is the technology in your cell phone? And then ask how old is the technology in the low-level laser that you're looking at. I can't say names, but I've opened up brand new low-level lasers that were built with 30-year-old technology. And these were not inexpensive lasers, nor were they off brands. But I can tell you, we at BioLight strive to keep abreast with the latest technology for all of our therapy systems. Next, we'll talk about the therapy systems that come with low-level lasers. We will start with the custom frequencies that should be programmed into your laser when you purchase it. Most doctors, or I should say very few doctors, really understand what frequency therapy is. Unfortunately, neither do the manufacturers of most pulse low-level lasers. And considering that this component comprises about 90% of the development and expense of any low-level laser therapy device, and that few understand its importance and very few are demanding precision in this area, this is where most manufacturers cut costs dramatically. As stated earlier, there are 3 primary bandwidths of frequencies that the body utilizes for different purposes. Inside each of these bandwidths, there are many different frequencies, and all of them can be corrupted, damaged, or changed altogether. Something that science has recently proven is that all physical illness can be identified in a corruption or change in these frequencies prior to the physical illness ever taking place in the body, which means by managing the frequency-based information of the body, we can actually correct a disease prior to the physical illness ever taking place. So, as many may think that early detection means finding a disease quickly or soon after it becomes physically apparent, but true health science now knows that early detection is finding and correcting the disease in the energy state before it ever becomes physically apparent. However, it also means that if you're not able to restore the corrupted information and or deliver the frequency-based information back to the body, or somehow help the body to do this on its own, there is no long-term correction of any chronic physical illness because it will continue to return. It amazes me that so many people wonder why medical science can't find the answers to so many health issues such as chronic illness, when in fact they have, but people just don't like the answers. They want drugs and surgery to be the answer, not natural energy medicine. It is true that current technologies do not have the ability to duplicate these required frequencies exactly, so we have to present to the body an octave of these frequencies with enough precision so the body can interpret the information we are trying to deliver. So the precision and range of pulse frequencies your pulse therapy laser can produce determines the intellectual level that you can communicate with and treat the body with. Because we understand the importance of frequency therapy, the BioLight Aura PTL2 therapy laser has a therapeutically precise frequency range from less than 1 hertz to over 12 million pulses per second. If you really look, we believe you'll find this to be somewhere from 2,000 to 4,000 times the precision and range of any other pulse low-level laser on the market. And this technology is readily seen in the therapeutic results. This is why we say that true natural energy medicine is not about changing the physical body. It's about managing and restoring corrupted information of the body so the body can change itself. You might say that we work on the software of the body while others are still working on the hardware or the physical body. Not only does your pulse low-level laser require the ability to pulse each laser, it also requires the correct pulse frequencies to properly communicate with all 3 frequency bandwidths the body utilizes. Since each therapy laser is manufactured with different technology and each has its own error rate and frequency limits, there are no standard frequencies for all pulse lasers. Each pulse therapy laser must possess its own frequencies designed to fit the engineering of that individual pulse laser to maximize the therapeutic results for each laser model. There are several well-known pulse low-level lasers that have no frequencies or therapy programs built into the laser at all. They just give you a list of frequencies that you can enter and run as you like. Unfortunately, these frequencies are not specific to the therapy laser, but usually drawn from a Rife list. Now, you must remember that frequencies developed by Dr. Royal Rife were designed to kill pathogens through the mechanical stimulation of an EMF or an electrical current. However, frequencies used in natural energy medicine were not designed to kill anything at all, but they're designed to resonate with the body's own normal, healthy frequencies, thereby restoring the body's ability to heal and recover from disease. Or when we do use specific frequencies for pathogens, for an infection or something of this nature, it is not to kill them directly, but to give the body what it needs to know so that it can kill or just manage them with its own immune system as it was designed to do. These frequencies have nothing to do with each other, and they're not interchangeable. We at BioLight understand the different uses of types of frequencies. We have created a custom physiological frequency list for our BioLight Aura PTL2 that will fully utilize the capacity of our therapy laser and then program them to the laser itself to be utilized with our own therapy system. At BioLight, we do not sell therapy lasers. We sell natural energy medicine therapy systems. These include the correct laser diodes, powered at the correct milliwatts of power, using precise physiological frequencies that have been specifically created for our laser to stimulate and the restoration of each cell, organ, or tissue that you're treating. We then add where to apply the energy for optimum results, such as trigger points or acupoints, for how long and in what order. We do this for every organ, tissue, and function that we know this therapy system is capable of helping. Finally, we add specific homeopathic remedies and substance-specific frequencies for each therapy program and apply them by inducting them into the laser itself. The BioLight therapy system comes with specific guides that are extremely simple to follow for almost any health issue your patient can present with. And most importantly, we continue developing additional therapy procedures and making advancements to the technology of our therapy system. Remember that natural energy medicine is still in its infancy, and it's advancing at a tremendous speed. So if your therapy system does not keep up, it's going to get left in the dust of those that do. So not only is the BioLight PTL2 therapy system state-of-the-art, but as advances in technology and therapies continue, we offer continual upgrades to keep your therapy system state-of-the-art. If you truly examine the difference between the BioLight PTL2 low-level laser therapy system and other therapy lasers, there's really no comparison between the two. With the BioLight therapy laser, you are purchasing a complete therapy system that is unsurpassed in the market today. Well, I want to thank you for your time and interest, and I pray this discussion was helpful in answering at least some of your many questions around low-level laser therapy systems. Thank you.
Thank you, Dr. Graham. And if you want more information, you're welcome to give us a call at 770-302-6900. Again, thank you for your time.